the CARE program, which stands for the Community Asthma and Air Quality Resource Education Program, is an asthma case management program for adults and seniors in Long Beach. After researching, I came across the American Lung Association's Breathe Well, Live Well curriculum, and it says Asthma Management Program for Adults. So I'm like, ta-da! That was in 2008. So it's 2014 now, and we're still using the curriculum.
This is a disease that crosses all scales of income and ethnic breakdowns, etc. But I think the importance of it and the focus and the concentration of it has really been for populations that really haven't had much access to health care, or if they've had access, it's been very limited, and the environmental aspects of where they live, they really need this extra assistance.
The CARE community health workers are responsible for conducting one-on-one home visits and providing the health education sessions in accordance to the Breathe Well, Live Well curriculum.
Para ellos es más fácil comunicarse con nosotros que con los doctores.
Our group of community health workers, they're from the community, so they know their participants, they know the neighborhoods, they know what these people are like, and they know how to relate to them on that level as well. And they also lend an empathetic ear when they're listening. They're not only just talking about asthma, but they're talking about these people's lives, and they're there hearing their stories and trying to come up with ways to help them empower themselves to make changes.
Antes estaba muy mal de la asma porque usaba hasta 3 veces el spray. La medicina que usaba mucho porque me sentía muy mal, y ahorita hay días que no lo uso.
When I'm sleeping, I have a short breathness, and it was hard to get the air back. It's like choking myself. And it was scary after somebody explained it. You know what? I'm worried about you because you look like you're gonna die, because it's like you're not getting the air back, and it's very something you need to ask for help. And I never thought for a moment to ask for help.
Y ya no sentimos tanto los síntomas. Está bien el líquido aquí. Todo esto.
One of the big things that we're most proud of is emergency services utilization, where we've been able to reduce those numbers. They've been kind of monstrously bad in some cases. We've had some clients come in, they've been hospitalized 4 or 5 times over the last 6 months prior to enrollment, and we've been able to get them down to 1 hospitalization. We've been able to wipe out hospitalizations significantly. I'd say about 90% of folks that come in with 1 or more hospitalizations prior, they have none over the course of the time in the program.
I think what's very important about this program is how important the environmental management piece is incorporated into the program. Why this is so important is because most of our medical providers, due to time, due to training, don't really incorporate that piece. It's very important that they get a good history of their home environment, their social status, poverty, etc. So this is bringing into play how important that is. So this supplements work that they need assistance with, and that hopefully over time they're going to be incorporating into their medical practices also, so that when they see a patient, they will incorporate all these factors, not just, all right, here's an asthmatic, this is how we're going to manage them medically, but it's so important to take into account where these residents, where these patients live, and what their home situation is like. I think the biggest benefits and successes have been related to really educating the public about asthma, really helping our population, our residents, learn how to deal with asthma as a chronic illness. And the benefits obviously are translated into reduced urgent care, hospital visits. I mean, that's a major win-win besides the comfort and support that it provides. I'd like to see this expanded and recognized by the health plans, and then maybe become an integrated model for all the medical providers and health plans so that everyone knows that this is very important in asthma management and that it becomes incorporated. That's my vision, and I hope we get there. This is a good start.